Tomorrow, a high-level delegation of the African Union, along with the Director General of the World Health Organization, they're hosting an emergency virtual meeting of the Ministers of Health on COVID-19 in Africa. They're having a look at the state of the pandemic, also evaluating the implementation of the Joint Continental Strategy, and that, of course, all about vaccines and the situation relating to vaccines and the vaccine rollout. Well, we'll speak now to our guest, and that, of course, is Timothy Fish Hodgson, legal advisor on economic, social and cultural rights at the International Commission of Jurists. Sir, good afternoon to you. You've been looking at the situation. You've published some data about this. You find that countries appear to be failing their people in actually rolling out vaccination. How do you assess the situation on our continent?
Thank you very much, Stephen, and thanks for having me here. The situation on the continent is overall very bad. The research that we've done is on Southern Africa, the Southern African Development Community, so the 16 countries within that, but the situation almost all across the continent is bad, with very low vaccination rates. I must say that there are some exceptions of countries which sort of prove that it is possible to vaccinate at higher rates. For example, Morocco has vaccinated something like 9 million people, and the Seychelles, although it's a small country, has got the highest vaccination rate as percentage of the population in the world. But we are struggling to even get vaccines into African countries. And then we have examples like Malawi, where they've had to throw away vaccines which actually expired. So we have a situation where what we're describing the African continent is that the majority of people in the African continent are the unvaccinated. And really, this is a new situation to find ourselves in, because we are experiencing a completely different experience of the world right now to people in other countries, most specifically in the global north.
Most of these countries are democracies, and the reason I make that point is that you would think that people would demand to get vaccinated. They will demand it of their governments. Their governments would be voted out of power if they weren't vaccinated. Why are countries then failing?
I think that that's a complicated question with a whole lot of complicated answers, and I'd hesitate to be able to paint every single country in Africa with one brush. However, there are failings in many democratic institutions in many countries all around the world, from the global north to the global south. There are many countries in which people are asking for vaccines, but one of the problems, Stephen, is that if there is not information given to the public about vaccines and their efficacy and their safety, and if there's misinformation given to people, they don't even want the vaccines. So there's some countries in which this has happened. For example, in Eswatini, the king believes that there is a medicine which is totally untested and unproven that cured him of COVID. And he's put that forward as a suggestion of what would be good to be done. And there's more reasonable reasons also for vaccine hesitancy. So, for example, the South African government itself decided to halt the J&J vaccines without adequate explanation, giving an indication to society that those vaccines might not be safe, and then proceeded again within weeks to start vaccinating people. So part of the problem in the African continent is that we are not getting vaccines, and part of the problem is that we're communicating sometimes very wrong information to our countries, and that influences hesitancy, which is quite high in the Southern African region.
There's so many different factors. It seems to me that if you just, never mind where in the world countries are, if you look at countries with production capability to produce vaccines, you really are looking at the United States and China. I'm going to put China to one side because of Sinopharm. Sinopharm vaccine hasn't been approved for use in South Africa yet. There's also vaccine diplomacy, which is incredibly complicated. But it seems to me that whether we like it or not, once the Americans have vaccinated the Americans, they're going to use vaccine doses that they can produce for their own vaccine diplomacy.
It may be the case that happens. It's very difficult to speculate with how global politics will unfold. The news this week is that the USA has supported, and some other countries have come out to support, the TRIPS waiver, which is a waiver of intellectual property rights in some way, shape or form, which should allow for vaccines to be able to be distributed more evenly, more affordably and more fairly around the world. But you're quite right that if countries try and use this for vaccine diplomacy, it would be wrong. There have some allegations that have been made that Russia and China have been trying to use this vaccines for the same reason in the African continent. And there have also been some questions that are asked of India about how it's impacted COVAX, which is the free distribution program that exists, because of the fact that India now, to deal with its current crisis, has halted the progress of COVAX distributing vaccines, which has had an impact even in Southern Africa. So you're quite right to say that this is a very, very complicated thing, and that what happens in one country very definitely impacts on the human rights of people in other countries and their ability to access vaccines. And it really is true that, as the World Health Organization has warned, that our own health depends on everyone else's health, and we are all in this together and have to make a better plan. Our report is focused at ensuring that there is greater sub-regional and regional cooperation so that we make sure that all of our people in all of the countries in Southern Africa and in Africa are vaccinated.
Timothy Fish Hodgson, Legal Advisor, Economic, Social and Cultural Rights International Commission of Jurists. I do appreciate the time. Thank you. Well, we go live.